Networks and Research Branch at Center for Global Health at National Cancer Institute. At CGH, she coordinates cancer research activities and bilateral engagements in South Asia region. She has worked extensively in South Asia region, implementing science research and developing and evaluating interventions for HIV prevention. In addition, she is also an associate faculty at the Johns Hopkins University Bloomberg School of Public Health, where she is involved in teaching and where she was a faculty prior to her federal tenure. She will now talk to us about NCI's Center for Global Health activities in women's oncology care in the world.
I'm delighted to be here and to particularly follow the speakers before me because that kind of sets the stage very well for my talk and for a couple of my colleagues who will be speaking soon after. So today I am going to make some remarks about the US National Cancer Institute and about our global research program. And what I'd like to do is to give you a brief introduction about the NCI. We have heard the abbreviation several times this morning. So the National Cancer Institute and what it does. And I will talk a little bit about the types of research that we fund. And I would like to also conclude by suggesting some thoughts and ideas about what it involves to set up a research program for cancer. So a little bit of history. I like history, and it was very fascinating to read about my own institute. So basically the US NCI is one of 27 institutes and centers that form the US National Institutes of Health. It was established in 1937 by an act of the US Congress. And interestingly, the words that were used were to conquer cancer, and it was adopted as a battle cry by the Public Health Service of the US. Another thing that was mandated for our center, for the institute to do, is to work very closely with government-supported cancer centers, and these you might have heard referred to as comprehensive cancer centers, or NCI-designated comprehensive cancer centers. We have 69 such cancer centers around 35 states in the US at this time. And this is something just to reinforce what we've heard this morning, and perhaps we hear continuously in our practice and research. And that is to say that cancer is indeed causing a lot of burden in terms of global mortality, much more than AIDS, TB, and malaria, prominent infectious diseases combined. So this is something that we all have thought about and we all continue to think about. But I think what's fascinating is this particular chart, which compares incidence, which is new cases of cancer, to mortality, which is deaths due to cancer. And what we can see here is not only are the projections for more new cases to occur in low resource settings, but you also have a projection of higher mortality, which is basically suggestive of the fact that there is some sort of inequity in terms of cancer care for populations around the world, particularly those who live in low resource settings. Now, why is there this kind of increase in cancer mortality? And it could be due to two reasons. One could be due to biologic reasons, because men and women, they may have different response to the disease. It could be a different disease, a different biology perhaps, different presentations. Individual patients may react to drugs and medications in a different way. But the other thing that I could hear both Drs. Malliga and Jayashree before me bring up is the role of these non-biologic factors, which is really a very important area to focus on in terms of cancer research, is to really understand why is it that women present late for cancer treatment. We have heard repeatedly from Dr. Shanta earlier and to all the speakers who spoke this morning, the lack of awareness about cancer, and the lack of awareness not only about cancer as a disease, but also about the need to seek timely care and early detection for cancer. So there is a lot of these sort of non-biologic reasons that need to be studied further and we need to develop strategies to address these differentials in order for us to empower women to come to see a doctor at a time where her cancer can be detected early, or at a time when the cancer can be managed effectively. Now, this is a little dated. It's 2008 Globocan data, but you can see, and as these arrows are pointing, that there's an abundance of cervix cancer around the world. And these geographical differences are pretty stark, because if you look at China, for instance, amongst women, there is a more burden of lung cancer. But interestingly, the literature, at least from India, shows that there is a shift, and we have heard about this shift. This is just presenting it in a different way, which is that there is more burden of breast cancer, particularly in urban settings in India, as compared to rural settings. So what I'm going to do very quickly is to talk a little bit about the different types of research that the US NCI funds. The first is sort of the basic biology research. So cancer biology is the broad category. And here, you do, researchers submit grants to sort of understand how the normal cells function, to explain cancer initiation, for instance, what happens at the cellular and genetic levels. So these are classic cancer biology studies. We also support studies that look at cancer etiology, and this category of research seeks to understand the causes and origins of cancer. So here, researchers may look at genetic, environmental, or lifestyle-related factors that are associated with cancer incidence. We also support a wide range of studies that focus on cancer prevention. This is particularly imperative in many parts of the world, because cancer is preventable, as we all have heard and as we all know. So there are population-based studies to understand primary prevention. This includes studies about vaccines, what are the best strategies to deliver vaccines, studies about risk factors. We heard of tobacco control, obesity control, alcohol abuse preventions. These are prominent risk factors for many NCDs, but predominantly cancer. And so we also have a large portfolio of studies that focus on cancer prevention. And this category also includes studies in the discovery and development of chemopreventive agents. And there are a few more categories, and this would be something that we also have referred to earlier on, which is to look at early detection, diagnosis, and prognosis. And research in this category really identifies, markers for early detection, imaging, and other methods that are helpful to detect cancer early. Cancer treatment research, of course, this is both treatments that are administered locally, such as radiotherapy or surgery, or treatments that are administered systemically, such as chemotherapy. And there is a lot of studies that we fund in this area. And finally, it is the more important of all these is when we're not able to avoid cancer, and when somebody lives with cancer, we want to understand how to control cancer. We want to understand the role of survivorship. So there is a lot of research that our institute funds to that are working with families and patients with cancer to understand what are the things that we can do in terms of coping with cancer, in terms of increasing and improving quality of life and end-of-life care, and so on. So this is just a snapshot of the type of studies and I've just picked two prominent women's cancers, not to say that they don't, other cancers don't affect women, but our breast cancer portfolio, as you can see, a lot of these studies that we support are either cancer treatment related research or cancer biology related research. And of course, there is 17% of our funding goes to support cancer control, survivorships, and outcomes research. Similar type of distribution for cervical cancer. And indeed, in the United States, even though the HPV vaccine has been rolled out, the uptake is very low. It's only about a third of girls who complete all recommended doses, much less amongst boys, although the recommendations for HPV among boys came a little later. But this area of trying to understand how to improve strategies at the community level to uptake HPV vaccine is indeed a priority and has been a recommendation from the President's Cancer Panel in the US, for instance. What I'll do now is go away from the bigger institute to our Center for Global Health. We have heard the Center for Global Health, or CGH, mentioned this morning. We sit within the Office of Director of the National Cancer Institute, and our center coordinates across different parts of the National Cancer Institute to support global cancer research. And I thought it might be useful to sort of not only list the website, but also to give you some examples of the type of studies or research that are currently open for funding. So the first one is an initiative that supports pediatric Burkitt lymphoma in low and middle income countries. And I'd like to draw your attention to these two, the next two, which is start with the letter K. And for those of you who are familiar with the NIH granting system, that is just our way of naming different kinds of grants. So if it's a K grant, it's typically a training grant. So the KO1 award, it's really one of the awards that support international scientists. So you need not be a person who is residing in the US. You're able to apply for these grants. As a resident of another country, you could collaborate with a US partner or not. And similarly, the K43 is also an Emerging Global Leader Award. So I urge you to look at these announcements, and you can contact any one of us here to get more information as you think about a research idea within the scope of that announcement. We also have another award that is studying not only cancer, but also larger non-communicable diseases in the global health space. I'd also like to give you some examples of another important priority of the NCI, which is to, in the global space, try and understand how we can use low-cost technologies. So these are research studies, and I'll give you some examples. But basically what we want to do is to support research that promotes the discovery, or invention rather, of new detection and diagnostic technologies that can be used in low resource settings to detect, diagnose, and in fact treat cancers. We also support small grants, which we understand that it's very competitive to get an NIH grant these days. The last we heard, it was about 7% of those who apply are awarded an NIH grant. So as a center, our interest is to stimulate research, and we support small amounts of funding to do some catalytic research in cancer around the world. In addition to research, there is a lot of training programs that our center collaborates not only with international agencies, but also with governments across the world. We have regional offices presently in 4 parts of the world. We do training programs in implementation research. We do training programs in clinical trials and clinical research methods. There is, of course, a very popular one, which is grant and manuscript writing. We find that when we travel to different parts of the world, there is a very big ask of us to help understand not only how the NIH grant-making machine works, but also how do you write a grant? How do I translate an idea from what's in my head or what's in part of discussions with colleagues into something that can be written up and fundable ultimately? We also do a lot of work with registries around the world, particularly in collaboration with IARC, to understand what is needed in terms of establishing a registry. A lot of countries have registries, so they may ask us to do a workshop, for instance, on how to analyze registry data so that they can keep track of how cancer appears and what is the burden of cancer in their particular country. Now, on the right-hand side are some programs that are happening within the NCI. So one that is currently open is a cancer prevention summer curriculum, which is basically a course over 4 to 6 weeks that talks about the principles of cancer prevention. And we also have a short-term scientist exchange program that brings people based on their particular research interests to labs within the NCI. Our center also works with governments and institutions to undertake cancer control planning activities. These are so the picture you see here is the Middle East and North Africa Forum. So you had countries from that region come together to discuss how do we as a country plan to implement a national cancer control program, what are our priorities based on the cancer burden in our country, and our center and colleagues at the center help facilitate that conversation across the world. So I'm just going to run through very quickly some of the examples of the grants that we have funded in the past. So here I've highlighted 2 grants funded in India, one to do with tobacco control in Dr. Prakash Gupta's group in Bombay. The other one was awarded to Tata Memorial, which is looking at cloud-based collaboration for radiotherapy. And these are really some examples, we are aware that this is a women's oncology forum, some examples of grants and research that we are supporting to look at cancer prevention, diagnostics, and low-cost technology. So the first one is basically, it's a gene expert test to detect HPV, and this project is trying to determine if a diagnostic that detects diverse HPV genes can be adapted. There is another project that is being funded at MD Anderson to look at high-resolution microendoscopy for diagnosing cervical cancer. There's also this very elegant device called the cryopen, and which is being adapted to be used in low and middle income countries in a way that is easily transportable, in a way that is powered by car batteries, for instance. So that is now currently being tested. There's another project which is looking at the performance, safety, and efficacy of a new cryotherapy device that uses liquid carbon dioxide instead of the standard one that is being used nowadays. We also have some very interesting, and we are looking forward to the results of these studies on oral cancer treatment. And this is basically a photodynamic therapy project to look at oral leukoplakia. Some examples of breast cancer detection and diagnosis research. And again, these are low-cost portable devices to do non-invasive screening of breast cancer. So this is just an illustration of the fact that we are really interested in trying to marry these great ideas in cancer research, particularly in the area of diagnosis and treatment, with the available tools and technologies these days. And hopefully we will be able to report, or our colleagues who have got these awards will be able to report data from these research studies soon. What I'd like to end with is a couple of slides that talk about some of the unanswered questions, not only in certain parts of the US, but also all over the world, where, and particularly in a country like India, I think there is so much tremendous opportunities to design and craft elegant research studies that can really be very context-specific and appropriate in terms of answering those questions. So first of all is the value of epidemiology in the States and in other parts of the world where you have made inroads into disease management. It is really